Hello, everyone. Welcome to week 7. This week we are reviewing chapter 8 in our text, and also you are working on your brochure assignment, so there is no discussion board post. Chapter 8 is looking at economics and healthcare. So there is some really important information about how economics influences healthcare in this chapter. We know that there is a link between poor health outcomes and poverty. I found it interesting that about 3% of our healthcare dollars are spent on population health, and the other 97% is spent on just individualized care. So I just thought that was interesting. You would think, um, with like our healthy people goals and that sort of thing, that a little bit more money would be spent on a community health perspective. In the 21st century, we are facing some different challenges. Some that were kind of interesting to me is the reemergence of old communicable and infectious diseases, which right away I thought about the measles outbreaks that we have heard about across the country. There is also an increase in foodborne outbreaks. Labor forces have changed. And of course, there's been changes in nurse education. For example, nurse practitioners now need to have that DNP, which could be a deterrent for an individual to get that advanced practicing degree, which then decreases the number of providers that are available to be seeing patients. Healthcare in the US is not cheap. Insurance coverage in the US is not cheap. In fact, for another institution, I had to complete an assignment where we compared a whatever procedure we wanted to what it cost in the United States and then what it cost in another country. And I decided to look at a routine colonoscopy and found it extremely interesting that in the United States, you go in thinking I'm having a preventative procedure done, and you understand how your insurance is going to cover that as a preventative procedure. But as soon as a sample is taken to be sent to pathology, your colonoscopy price now completely skyrockets and change from a preventative to now a procedure. So you kind of wake up and have a completely different bill now because that one specimen was taken. And that was kind of mind-blowing to me because I did not realize the depths of how insurance and healthcare work together. So that was really enlightening. And I think that this chapter you'll find has some interesting information that you'll kind of have some maybe like aha moments. After you read this chapter, you are going to create a brochure that you can actually use in your school nursing practice. So, as nurses, we may be the voice that parents hear to understand, like, hey, you very well could qualify for state-based insurance, or you don't have private insurance, so you should apply for state-based insurance. So, the goal of this brochure is for you to create something that your target audience would be the families and guardians, parents of your community where you're working at now. If you're not a school nurse, then where you may potentially work there in your state. And you are going to include information in your brochure that is specific to your state. So if I was doing the brochure, I'm going to be looking at what Pennsylvania families need to do to qualify, what the benefits for families in Pennsylvania are. And you're going to look at each of those areas and create this brochure. So the brochure audience, again, should be for your families. So make sure you're thinking about that when you're using your verbiage and the flow of it and that sort of a thing. Be sure that you carefully review the rubric for this assignment and that you're including all elements of the assignment. APA is required for your in-text citations, and there should be a reference section somewhere in the document that is APA. I do understand if to kind of get it to fit in there that maybe the font size is not a size 12 whenever you're typing up your reference lines, and I understand that that is fine. But I do need to see a reference section with the references, properly done, less maybe the font size. If you have questions about the assignment, please don't hesitate to contact me. I am happy to help. If you want to Zoom to discuss it, we can certainly set that up. Or if you just want to email me with any questions or concerns, hang in there. You have this project and one more discussion board, and we have wrapped up this course. Have a great week.